The CBC News exclusive, secret recordings that show the Alberta government has overruled some of its top health experts in shaping its pandemic response. Alberta's moves have come under scrutiny in recent weeks, with some accusing Premier Jason Kenney of putting the economy before Albertans' health. Kenney has always maintained his government's response has been based on the advice of the province's top doctors. But these new recordings suggest that may not have always been the case. Jenny Russell has our exclusive report today.
20 recordings of pandemic response meetings obtained by CBC News reveal Premier Jason Kenney and his cabinet often micromanaged the actions of civil servants, including Chief Medical Officer of Health Dr. Deena Hinshaw, and sometimes overruled their expert advice. Confidential sources say Kenney is more focused on the economy than public health measures.
Great to be here with Health Minister Shandro, as well as our Chief Medical Officer for Health, Dr. Deena Hinshaw.
On June 9th, the same day the Premier announced the province's Stage 2 economic relaunch, Hinshaw relayed the political direction she was receiving.
Essentially, I think what we're hearing, and we just want to test with the Minister's office, because they don't want us to enforce anything. They want us to educate and no enforcement.
University of Alberta health law professor Ubaka Ogbogu says politicians are clearly undermining Hinshaw's authority.
The story tells me that the Chief Medical Officer of Health doesn't have control of the pandemic response. It tells me that decisions are being made by persons who shouldn't be making decisions.
Hinshaw did not respond to an interview request. At a news conference yesterday, she said her job is to provide a range of policy options to Cabinet, who make the final call.
I am grateful that my recommendations have always been respectfully considered in the final decisions.
A spokesperson for Kenney said it is the job of elected officials to make these decisions, and he said there was no political interference. Jenny Russell, CBC News, Edmonton.
There is more information on these secret recordings, the 20 which CBC News has obtained, and also the information that is contained on those recordings up on our website. Jenny Russell and also Charles Rusnell have put together an extensive investigative piece on what they have learned, and it's up on our website for you this morning at CBCNews.ca. This coming up to public attention at a time when Alberta has reached what Dr. Hinshaw calls a tragic milestone. The province has now recorded its 500th COVID death, and that is not the only troubling figure from Alberta. There are now 355 patients being treated in hospital in Alberta, the highest number since the pandemic began. 71 people are in intensive care. Alberta Health Services is planning to transfer patients and repurpose clinical spaces to increase the number of hospital beds available, hoping to boost ICU capacity by 400 beds, anticipating need in the coming weeks. Here's part of the reason why. Alberta currently has more than 13,700 active cases. That is not just a provincial record, it is the highest in the country.